the education CS that all teachers need to be tested before they resume teaching. And you estimated 4,000, did you say? Or was it greater than that? 300,000. 300,000. I think we have to look at this in the context of timing as well. As you know very well, the discussions on when education, and I will not speak for education on this, I'm just stating what I have seen, the discussion that is out there in the public regarding when to open schools. And it seems that opening schools is, at least I think from the education point of view, they're looking at some time in the beginning of next year, isn't it? That's why I said timing and context is important, because we do not know where we will be at that time in terms of the testing levels. However, I agree with you that testing such a huge number of people at any time is going to be a very big challenge for us. We will, of course, be in discussion when it comes to matters of this kind. We will be sitting with the relevant sectors and ministries so that we come to a consensus on what is the best approach to be able to make sure that children coming back to school, as well as the teachers who are teaching them and the staff in those schools, are safe and protected. And we will have to sit down and come up with a workable solution, a workable way of testing. As we have gone along our testing journey too, given the constraints that we have, the costs of the test, the difficulties of the supply lines, we will also be looking at reviewing our own testing strategies. The testing might move towards going to where it is really useful and where it will be able to inform us in a better way. And so all of these discussions are taking place, and I'm sure that when the time comes, because if you remember, even truck drivers, restaurant and eateries workers and all of that are also constituencies that need to be looked at. So we are looking at this very carefully, and I'm sure that we will work out a strategy that will be able to apply the resources that we have in terms of testing to the points that will be most useful for us in informing us about the spread of the disease and in directing our action to those areas to prevent, to contain the disease and prevent its spread. Graham Kajilu, Standard. Your question was, number one, you needed to know the total bed capacity in the country, bed capacity. But beyond that, you also wanted to know the ICU bed capacity. In the counties, you also mentioned that some counties you have heard have ventilators, but they have no ICU. And you also posed the question, are all our level 5 hospitals in the public sector ready for the COVID response? I have with me today the technical person who is Dr. Kuria, and I think he may be able to provide you with some figures, if he is able to, on these statistics that you have asked. So that question I will ask Dr. Kuria to respond to. Nancy Okwaro, your question was really about the infection in children. You mentioned, yes, of course, it is not the first time we are reporting that there is an infant or a child among the positives. The question you ask is this child being infected? How is this child getting infected? Is it from other children, or is it from adults and other people? I think that is a difficult question to answer, because without the facts, without the circumstances surrounding where the child was, without the facts of whether the child is actually a contact that has been traced, because it is the contact tracing that really tells us who picked an infection from who. So we may need to want to go back to our contact tracing and determine where we had children. Were they the index cases, or were they contacts that picked up the disease from somebody else, and in that case from who? But what we can say is that the fact that we are already getting children infected means that children are not spared this disease. In the earlier phase of this pandemic, especially in China, when it was ravaging China, the information that was coming out was that children are not as infected as adults. I think that that seems to still remain the observation in many cases, perhaps even in our own case here. We are not seeing too many children who are getting infected by the virus, but it does infect children, and sometimes it can even lead to severe disease and death in children. So some of these things will unravel themselves as we move forward and collect more data to determine how this virus actually spreads among the different age groups within a population. Okay? So clearly we know from what we are seeing that particularly the youth are quite infected. Many of the asymptomatic cases we see tend to be in the youth ages. And we also get older people infected. Our worry, as has been observed in many other places, is really the older people. When they get infected, then they can progress to severe and critical disease because, number one, they are old and their immune system is weakened, but two, most of the times old people will also have other non-communicable disease conditions. And we know very well that when a person who is old and with an underlying non-communicable diseases is infected by this virus, then the outcomes of that infection can lead to severe or critical cases, and in certain instances, even death. So whether children play together and pick it from each other, I don't think we can answer that. If already the infection rate we see in children is small. But again, remember, when we also sample, we are biased in sampling. We may sample a few children, but I do not think that the sampling that we carry out has a high proportion of children in it to be able to definitively answer whether children, what is the rate of prevalence of this in children. So we don't know yet. We will need to look at that contact tracing. The issue of children wearing masks has been debated globally in many countries because, of course, children present great challenges with respect to this disease because of the children's nature, playful nature of being together, being close together, being playful. And of course, we can't expect children to observe measures as we would adults. So, and wearing masks also creates a problem for children, particularly young ones, in terms of breathing. I think this debate has been going on for a while. I believe that if the households and the family members of the households are able to practice social distance, then it is possible to protect the children also without having to subject them to these difficulties of having to wear masks. Okay? So let me now hand over to Dr. Kuria to respond to